Okay po.
Good afternoon, everyone. Welcome to our LAMP webinars. We will start with the first presentation, blood. Areas of blood stasis. So we have partially purple tongue. Just as in the case of the pale and red tongues, a tongue may also be partially purple in a specific area. The three areas that are commonly partially purple are the sides, chest area, and the center. Purple sides indicate blood stasis in the liver or in women in the uterus. Okay. So remember women, pag purple yung sides po ninyo, that could be blood stasis in the uterus. A purple color in the chest area, blood stasis in the heart or lungs, in the sense of Western pathology, or in the breast of women. A purple color in the center, blood stasis in the stomach. So here we have pictures of the tongue with the partially purple areas. No? So here, the first slide on the left is the tongue with the purple sides. This could indicate blood stasis in the liver or uterus. The middle tongue, purple chest, breast area, blood stasis in the chest or breast, so lung, heart, and breast. Purple center, blood stasis in the stomach. So Ma'am Dina, Ma'am Mildred, please take over. Welcome. Okay lang po kahit na late. I know you're having problems with connection. Good afternoon, Ma'am Mildred. Okay.
Naka-unmute po, Doc, siya.
Please unmute po.
Ayan, ayan. Magandang hapon po, pati itong laptop ayaw.
Hindi na brown out. Very good.
Opo, nag-on and off po yung aming, kuryente. Sana wag mawala.
Sige. Welcome po.
Magandang hapon po sa ating lahat. Magandang hapon po, classmate. Pagpapatuloy po natin ang ating pag-aaral about tongue. So, ito po yung tongue picture. Kita po natin yung bluish purple color. Ayan, makikita po natin blue talaga siya. Then, sa right side po ay reddish purple. Then, reddish purple. Ito po yung uli, reddish purple. So, grabe po yung mga picture na. Ito po, makikita natin yung bluish purple sa side po, ano? And reddish purple. Halos luto na siya, oh. Bluish purple. Next. And yan, mga bluish purple po siya. Ito sa baba. So, blood stasis in women. Pag purple sides po, tingnan natin. In women, purple side, yun po yung liver area. May indicate blood stasis in the uterus. As blood stasis in the uterus is very common, purple side in women usually indicate blood stasis in the gynecological system rather than in the liver itself. It is important to remember, however, that the tongue may not be purple in women, if the blood stasis is relatively mild. So kung mild pa lang, hindi pa po siya talaga magpa-purple. So in other words, a woman may display all the symptom of blood stasis in the uterus, yung pag may painful period po with dark menstrual blood, tsaka may mga dark clots po tayong makikita, without the tongue being purple. Moreover, the degree of severity of purple color of the tongue in women is directly correlated to the severity of blood stasis. Yun, pag sobrang purple na po talaga, may matinding blood stasis na yung katawan ng babae. We can identify 4 stages of blood stasis according to the tongue. So, number 1 po, normal body color. Number 2, purple veins underneath the tongue. Number 3, purple sides. Number 4, whole tongue purple. So, 4 degree of severity of blood stasis. Yan po yung ating picture. So, yung normal body color, number 1. Tapos yung purple veins underneath Nakita po natin yan, no? Yung parang namamagana yung ugat. Next, number 3, yung purple side, liver and gallbladder area. At number 4, nakita po natin yung full body purple. So, purple chest, ito sa mga sabay breast area. As explained earlier, the chest area on the tongue reflects Western pathology of the heart or lungs, or of the breast in the women. When the chest area reflects pathologies of the heart or lungs, this will be very obvious from the symptom. Example, may coronary heart disease po siya or may chronic obstructive pulmonary disease. So, sa babae po, pag sa chest area, nag-reflect po ito na ang breast, especially when the purple color is unilateral. So, pag nakita natin sa isang side, may purple color, breast po yun sa breast. So, ayan po yung ating mga picture. Purple chest breast area in women. In women, a purple color in the breast area often appears in breast cancer, as this usually occurs against the background of bloody stasis. This is correlation between the purple color of the breast area and the prognosis. So, pag darker po yung area, mas worsen po yung prognosis nito. If the breast area on the tongue is purple in women who have not been diagnosed with breast cancer, so this sign indicate a tendency towards the disease before a symptom manifests. So pag nakita na po talaga natin yung purple na yon, possible po na mayroon siyang breast cancer. So for this reason, observation of the chest area in women is particularly relevant. Lewis purple, yun po yung sa side breast area po yan. Sa side ng tongue. Tapos pag purple filled chest breast area din po yan, reddish purple chest breast area. So pag nagtatang diagnosis tayo, mahalaga pong titigan natin yung side na yan. Kasi nagsasabi nga yan kung ano yung situation, no? Lalo sa mga babae. Okay po, thank you po.
Okay, this is a very interesting topic kasi we can do something na hindi pa makikita sa Western, no? So
Opo.
what is important is if may nakita na po tayong blood purple na po yung sublingual veins or congested na, kailangan na po nagpapa-acupuncture or mas mabuti, wala pang nararamdaman, magpa-acupuncture.
Opo, para ma-dispel pa po yung kung may mga nag-i-stagnate na po doon, matanggal na natin. Kasi pag natatanggal sa pamamagitan ng acupuncture, hindi lalala yung sakit. Kasi ang dami po ngayon may breast cancer.
Yeah, wag natin antayin na yung purple, yung tongue na yung purple. Okay?
Opo.
Kasi pag hindi po siya pale or red, so it's purple. Okay. Maraming salamat po, Ma'am Mildred.
Thank you, Lord. Hindi na purple ang sublingual veins ko.
Ay, wow. Thank God. Let's now go to tongue diagnosis. Let's welcome Ma'am Teresita Sumile from Rizal. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome to tongue diagnosis, and now let's talk about red tongues with kidney deficiency. A common result of kidney deficiency is development of heat from deficiency, which over a long period of time will dry the fluids and injure the blood. When this occurs, the tongue appears red and dry with little foaming. The stronger the heat, the greater the injury to blood and fluids, which in turn leads to a redder and drier tongue body. Symptoms associated with kidney deficiency with heat are tinnitus, night sweats, hot palms and soles, dry mouth, and flaccid face. In constrained heat, smoldering fire or fire toxin can develop, manifesting an extremely red tongue covered with a yellow coating. Symptoms associated with this excessive disorder are fever, irritability, dry mouth and throat, thirst, and mouth ulcers. Heat and fire are capable of injuring blood as well as blood vessels, leading to spontaneous bleeding. Heat in the blood is characterized by excessive menstrual bleeding, red, itchy skin lesions, general feeling of heat in the body. In this case, tongue body is completely red, possibly a deeper root or scarlet red. To evaluate origin, degree, intensity of heat or fire, and resulting injury to yin and fluids, practitioners should observe not only intensity of red discoloration on tongue body, but also its shape and coating. Heat generated by deficient yin that smolders for a long time in the body and then becomes uncontrollable will affect the essence. This energetic deficiency, which can develop over the course of years or be accelerated by serious illness, may lead to sudden collapse of yin, which thereby allows the yang to rise uncontrollably. Mildest expression of this energetic imbalance is sudden loss of hearing, while its most severe form is cerebral stroke. In some cases, burning out syndrome, often followed by a nervous breakdown, is subject to same pathology. A good visual image for what happens energetically is a candle burning at both ends. Okay? Now, the candle wax is the substance, which corresponds to yin and essence, while the flame corresponds to yang. At the end, when the wax finally burns away, there is a short, intense flickering of the flame. It is the excessive yang. This upward blazing fire in the body vents itself in myocardial infarction, stroke, hypertensive crisis, or uncontrollable bleeding. Tongue body is red, dry, contracted, and or stiff. The heat has injured fluids and yin so severely that muscles, sinews, tendons, including those of the tongue, become malnourished. This condition can cause internal movement of wind. Deep red discoloration of tongue also arises when heat enters the nutritive and blood levels. Surprisingly, this pathology can also produce a soft red tongue, an indication of malnourishment of sinews and tendons due to extreme heat, as what we can see in that tongue picture above. Okay. Now, patients with this tongue type often suffer from hemiplegia following stroke or from atrophy disorders. The soft red tongue is accordingly an unfavorable prognostic sign. Okay? Yun lang po. Thanks so much for listening.
Thank you very much, Ma'am Teresita. Next, we go to diagnosis by interrogation. Let's welcome, straight from Baguio, Ma'am Vina Pascua. Good afternoon, Ma'am Vina.
So, magandang hapon po, Doctor. Magandang hapon po sa lahat. Sexual symptoms, day 2 po. Continuation po ito kahapon at impotence po ang ating topic. Sa men, impotence, ito yung karaniwan na sexual complaint po ng mga lalaki. At ang unang sanhi po nito that would come to mind would be a kidney deficiency and especially a kidney yang deficiency. This is a common cause of impotence, especially sa may mga edad na lalaki. In which case, it is accompanied by sumasakit ang kanilang likod, mahina ang tuhod, may dizziness, may tinnitus, at saka poor memory. Impotence should be differentiated from lack of libido. The former indicates an inability to sustain or obtain an erection. Although sexual desire is normal, the latter indicates lack of sexual desire naman, but normal erection. Yan po. Then punta po tayo sa MT, kidney yang deficiency. Impotence, lower backache, cold knees, feeling cold, bright white complexion, weakness, tiredness, lassitude, abundant clear urination, or sa gabi urination at night, pale and wet tongue. So, deep weak po ang pulso. Ang gagamitin na acupuncture points dito ay kidney 3, REN 4, bladder 23, kidney 7, do 4. Moksa po. Spleen and heart yang deficiency, impotence, premature ejaculation, poor appetite, slight abdominal distension pagkatapos kumain, tiredness, lassitude, pale complexion, weakness of the limbs, loose stools, feeling cold, so cold din ang kanilang limbs, edema, palpitations, shortness of breath on exertion, spontaneous sweating, slight feeling of discomfort or stuffiness in the heart region. So, ang dila po ay pale and wet. At ang pulso ay deep weak. This type of impotence is very common, probably more so than the type from kidney deficiency. Acupuncture, REN 12, stomach 36, spleen 6, bladder 20, heart 5, bladder 15, REN 15 po. Moksa din. Liver and kidney yin deficiency, impotence, dizziness, tinnitus, weakness, hardness of hearing, lower backache, dull occipital or vertical headache, insomnia, numbness or tingling of the limbs, dry po yung eyes, blurred vision, dry din ang lalamunan sa gabi, dry hair and skin, brittle nails, night sweating, dry stools, normal colored naman po yung kanilang dila pero walang coating, at floating empty ang pulso. Ang acupuncture points ay kidney 3, REN 4, bladder 23, liver 8, at saka spleen 6 po. Then last ay kidney essence deficiency. Impotence, softening of bones in adults, nabibingi na rin, weakness of the knees and legs, poor memory, loose teeth, hair falling out, o kaya premature graying of the hair, weakness of sexual activity, lower backache, infertility, sterility, dizziness, tinnitus, pero normal naman yung kanilang dila, and floating empty, o kaya liver pulse if kidney essence deficiency occurs against a background of kidney yin deficiency. Pale tongue and deep weak pulse if it occurs against a background of kidney yang deficiency. So, ang acupuncture na gagamitin dito ay kidney 3, REN 4, kidney 10, bladder 23, bladder 52, at saka kidney 13. So, yan lang po. Thank you again, Doctor. Thank you sa lahat.
So after the lecture, medyo marunong na po tayo mag-treat ng impotence with the different patterns. Maraming salamat po, Ma'am Vina. Let's proceed now to Hall's diagnosis. Let's call once again on Ma'am Mildred. Ma'am Mildred, good afternoon ulit.
Good afternoon po muli. Magpapatuloy po natin ang ating pag-aaral, pulse diagnosis, other pulses qualities. Choppy pulse. So this pulse is often also translated as a rough or hesitant pulse. A choppy pulse can be experienced in various ways. So the pulse can feel coarse and rough like sandpaper beneath your finger. The pulse feels a bit dry. Another quality the pulse can have is the strength and rhythm may vary whilst you are feeling it. It is therefore also called a 3/5 pulse in Chinese, because sometimes there are 3 beats to its breath and sometimes there are 5 beats for each breath. So kaya po tinawag na 3/5, 3 or 5 yung beats. Even though the rhythm can vary, the pulse does not skip any beats. It just accelerates and decreases in speed and or strength. One of the classical image used to describe this pulse is that it feels like a knife being scrapped along a piece of bamboo. Yung para kung nagkikis-kis kayo ng kutsilyo sa bamboo. So, this conjures up two images. First, there is a roughness in the fingers as the knife scraps along the bamboo. Second po, yung knots ng bamboo are evenly distributed and are different sizes. So this means that there will be an unevenness in the frequency and the size of the bumps as the knife pass over them. So na-imagine po natin pag nagkis-kis kayo, may hindi pantay-pantay na kaya parang may tumatalon. So another classical image that demonstrate how the choppy pulse feels and fine. Yung para naman po tong pula na nalalaglag sa mga buhangin. So, nagpapakita po ito ng slightly abrasive sensation in the mind. So, in comparison, yung normal pulse feels like the rain running off a smooth jade stone. The reason why this pulse has these rough and choppy qualities, dahil daw po yung chi at saka blood ay hindi nagpo-flow ng freely. So the pulse has therefore lost some of its smoothness. So yung choppy pulse po I will not always rise due to there being too little blood in the vessel. So meaning, yung blood po cannot flow unhindered and smoothly through the vessel. This is like a stream that is starting to dry out. The pulse will be relatively weak if the pulse is replete and choppy. So, dahil naman po ito sa excess condition ng blood, nagkakaroon ng stagnation. In the stagnant blood is preventing sweat or blood from flowing freely through the vessel. So, apart from sweat stagnation or blood stagnation and swesu or blood deficiency, the choppy pulse can also be seen when there is jinye shu and jing shu. Naalala po natin yung jinye, ito po yung body fluid. Ibig sabihin, deficient ng body fluid. Tapos yung jing naman, ito yung essence. So, pag jing shu, jing deficiency. Where the slippery pulse is normal and signifies positive qualities and pregnancy. The choppy pulse is very negative sign if it suddenly appears in pregnancy. Kasi ito po yung sign na pwedeng makunan ang babaeng buntis. Kung slippery kung choppy yung mararamdaman natin. So choppy pulse, pattern of imbalances. Makakaramdam po tayo ng choppy pulse kung mayroon siyang sweso or blood deficiency, sweat stagnation or blood stagnation, jinye shu and jing shu. So yung typical combination ay choppy and wiry, chi and blood deficiency po yan. Pag choppy and replete, may blood stagnation. Pag choppy and weak, chi and swesu. Choppy and saggy, chi and blood deficient with dampness. Choppy and deep, chi and swesu. Choppy and knotted, blood stagnation due to excess or deficient cold. Thank you po.
Thank you very much, Ma'am Mildred. We go now to differential diagnosis. Let's welcome Ma'am Needs you. Good afternoon po, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. Doc, how's my audio?
Very clear and very alive.
Sana wag mawala yung internet. So, welcome everyone to TCM Foundations number 200. Small intestine chi pain. Okay. So, this cause etiology, yung mga dahilan nito, excessive consumption of cold and raw foods, emotional states, yung anger, frustration, and resentment. So, take note po niya yan. Underlying and or accompanying pathology, stagnation of liver chi invading the spleen chi deficiency. Sign and symptoms, lower abdominal twisting pain, which can extend to the back. Abdominal distension, medyo paglaki yun eh. dislike of pressure on the abdomen, borborygmi, flatulence, yung abdominal pain relief with the passing of the wind. Alam niyo na kung ano yun. Pain in the testis. Okay? When you palpate the pulse, it is deep, wiry, especially in the rear position. Pag tininan niyo yung tongue ay mayroong white coating. Ang treatment principle, force the liver and move chi in the lower burner, stop abdominal pain, harmonize liver and spleen. Acupuncture treatment points, when 6, it moves chi in the lower burner. Stomach 29, stops pain, regulates small intestine. Liver 3, relieves stagnation of liver chi. Gallbladder 34, moves stagnation, relieves pain. Stomach 27, moves chi in lower burner. Spleen 6, stops abdominal pain. And stomach 39, lowers C point of small intestine. So the technique is with drainage. Okay? Thank you very much, and I hope you learn from this.
Of course. Maraming salamat po, Ma'am Nitz. Tuloy-tuloy tayo with acupuncture patterns and practice. And let's listen once again to Ma'am Teresita Sumile. She will talk about edema. Good afternoon ulit, Ma'am Teresita.
Good afternoon ulit po, Dr. Hector and classmates. Welcome to Acupuncture Patterns Practice. Now let's talk about edema. Edema is the abnormal retention and accumulation of water in the body as a result of failure of the lung, the spleen, and the kidney in their functions of transforming, transporting, and distributing fluids. The excess water then overflows into the interstitial tissues in the muscles and the skin. Clinically, it is seen as puffy swelling in the head, face, eyelids, extremities, the trunk, or even the entire body. The causes of the dysfunction of the lung, the spleen, and the kidney that can lead to edema include attack by exogenous disease-causing pathogens, improper diet, and internal injury by overexhaustion. Based on the nature of these causative factors, the book Dunsh's Experiential Therapy classifies edema in two main groups. These are yang edema and yin edema. Etiology and pathology. The formation of edema is the manifestation of dysfunctional chi transformation throughout the body. This dysfunction may be due to attack by exogenous pathogenic evils or to internal injury. The principal abnormality is in the Zhang organs, like the lung, the spleen, and the kidney. But the process also involves the Fu organs, like the urinary bladder and the Sanjiao. Among the Zhang viscera, the kidney is the root and the lung is the appearance, while the spleen controls water movement. If there is impairment of the dispersion function of the lung, the transportation function of the spleen, and the gate controlling function of the kidney, then the Sanjiao loses its ability to regulate water and gallbladder chi its activity. This failure impairs the proper circulation of water so that it overflows its normal channels into the skin and muscles and produces edema. Now let's go to yang edema. Edema due to wind invasion to the lung. This impairs the lung's ability to ventilate. The lung is the lung is the upper source of water and it governs dispersion and descending. When exogenous wind lodges in the lung, its dispersion and descending are impaired. As a result, water movement also becomes impaired. The interaction between exogenous wind and the retained water leads to the overflow of water into the superficies, giving rise to edema. Next is dampness infiltrating the spleen. Dampness infiltrating the spleen can trap spleen chi. The spleen prefers to be dry, living in a humid place, wading in water or getting drenched by rain can all conduce to dampness attacking the middle jaw. Overindulgence in raw and cold foods can also conduce to attack by dampness. When dampness traps spleen chi, the spleen is unable to transport and transform water. Water then overflows its normal pathways into the superficies and gives rise to edema. Next is internalization of dampness toxin. The superficies is the exterior region governed by the visceral organs of the lung and the spleen. When lesions of the superficies, such as abscesses and carbuncles, are inadequately treated to eradicate their the poisons can transmit to the interior and attack the lung and the spleen. This attack can impair the spleen's ability to transform and transport water and the lung's ability to regulate the water pathways. Water can then overflow into superficies and give rise to edema. Then dampness heat accumulation. Accumulation and gelling of dampness can trap sanjiao qi and transform into endogenous heat. Dampness and heat in the sanjiao prevents the ascending of the clear and descending of the turbid. Obstruction of sanjiao qi movement induces blockage of water passage, leading to water overflowing its normal pathways and giving rise to edema. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Next, we listen to Ma'am Vina Pasqua for signs and symptoms. Continuation of her presentation yesterday. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. Signs and symptoms, day 92 po, hot and painful eyes. So, continuation po ito kahapon. Phlegm, heat, hot and painful eyes, sticky po yung eyelids, blurred vision, feeling of heaviness and muzziness of the head, a feeling of heat, pula po ang mukha, greasy yung skin, feeling of oppression of the chest, so sputum in the throat, expectoration of yellow sputum, dizziness, nausea, red and swollen tongue with sticky yellow coating kasi nga phlegm head, slippery, rapid pulse po. Next, blood stasis in the head. Painful eyes, not necessarily hot. So my dark rings po under the eyes. Headache, dark complexion, bulging eyes, mental agitation, purple po ang dila, at wiry pulse kasi nga blood stasis. And the next ay liver blood deficiency, dull ache in the eyes, at not necessarily hot din, blurred vision, floaters, dizziness, numbness or tingling of the limbs. Scanty po yung menstruation. At yung complexion po, dull pale. At yung dila, pale tongue, choppy or fine pulse. Then next naman tayo ay heart blood deficiency. Dull ache in the eyes, not necessarily hot then. Dull headache, palpitations, dizziness, insomnia, dream, disturbed sleep, poor memory, anxiety, propensity to be startled. Dull pale ang complexion po, pale lips, pale din ang, at saka thin yung tongue. Choppy or fine pulse. Next naman ay kidney deficiency. Dull ache in the eyes, not necessarily hot, dull occipital headache, blurred vision, floaters, dizziness, tinnitus, lower back ache, poor memory, Other manifestations including tongue and pulse, depende po kung whether there is kidney yang or kidney yin deficiency. Sa deficiency of qi and yin naman, slightly hot and painful eyes, may mild pain, so desire to shut eyes, dry eyes, slightly red eyes, dizziness, tiredness, dry po yung lalamunan, those stools, poor appetite, pale ang dila, o kaya normal colored tongue pero walang coating, weak or floating empty pulse. Pag may invasion of wind heat, hot and painful eyes with sudden onset, red eyes, aversion to cold, fever, cough, may sore throat, stuffed or runny nose with yellow discharge, masakit ang ulo, masakit ang katawan, slight sweating, slight din na nauuhaw, swollen tonsils, tongue slightly red on the sides in the chest area or on front part. At ang pulso po ay floating, rapid. Yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. We now go to the last presentation. It's about bleeding. We shall continue our discussion. Now we go to pathology of bleeding. There are four main pathological conditions involved in bleeding: Qi deficiency, blood heat, blood empty heat, stasis of blood. Qi deficiency and blood heat are the two most common ones. Okay, so before discussing the pathology, it is opportune to recollect briefly the physiology and pathology of the connecting or luo channels. The connecting channels are called luomai. Luo means network. The main channels are called qingmai, and qing means line, route, or way. Therefore, the main channels are compared with routes or lines, which implies a vertical flow of qi, whereas the connecting channels are compared with a network of channels flowing in all directions, which implies a horizontal flow of qi. So here you have a figure showing to us the connecting channels and the space between the skin and muscles. The connecting channels are more superficial than the main channels, and they run in all directions rather than vertically. They fill the space between the skin and muscles, the Schulli space. Yan po, no? So we have the main channel and the connecting channel. So the vertical and horizontal flow of qi in the main and connecting channels. There is also a deeper layer of connecting channels which lies beyond that of the main channels. The channels in the deeper layer can be called the deep connecting channels or blood connecting channels. They are energetically related to the blood vessels and blood in general. So these are the energetic layers of the main and connecting channels and the types of qi. So the space between the skin and muscle is the defensive qi level. We have the superficial connecting channel. Then the connecting channel is on the defensive qi level. For the at the qi level is the main channel. Now, some blood level is the deep connecting channel. The spiritual axis in chapter 81 says, if fluids are harmonized in the middle burner, they are transformed into blood. When blood is harmonized, it first fills and irrigates the blood connecting channels, then percolates to the connecting channels, and finally in the main channels. If we think, for example, of the cross-section of a limb, the levels of connecting channels are as follows: superficial and minute connecting channels proper, main channel, and the deep or the blood connecting channel. In chronic diseases with blood stasis, it is the blood connecting channels that are involved. In bleeding from blood heat, the heat is at the level of the blood connecting channels, and that is why Chinese books often recommend cooling the blood connecting channels. It is also for this reason that the connecting points can be used to stop bleeding. Thank you very much for listening. If there are no questions, we would like to say thank you to everyone for joining, and special thanks to our speakers, our presenters. See you again tomorrow, same time. Good afternoon,
Thank you din
everyone.
po, Dr. Hector.
Very
Thank you
much.
po.